Good evening, everyone. My name is Brenda Alberg, Kenai Peninsula Borough Information Officer, and with me tonight is Dan Nelson, our Incident Commander, and we are here to provide you an update on what's going on with regards to COVID-19 response on the Kenai Peninsula. Good evening, Dan.
Evening, Brenda, and good evening, everybody. Welcome to our community conversation for Tuesday. Hope everybody had a very good weekend. I've got a couple updates, and we'll get into some things here, and we'll be able to take your questions here as time allows. Please go ahead and post those in the comment thread. So from a perspective for COVID-19 and your incident management team, we've been working with the state and with our local partners quite a bit and really wrapping up a lot of the long-term planning and kind of groundwork that's been happening. So a lot of those things that had to do with our hospitals are wrapped up, and they're ready to go as we need to. Our volunteer management and some of those things and that clearinghouse plan that we talked about here last week is set. And now we're kind of in that standby mode, more of that path where we're seeing that Alaskans have done a good job in contributing to flattening the curve and being able to get our numbers down. So hopefully that will continue as we continue to make the right decisions for ourselves and our neighbors. So for the state of Alaska total, we have 329 cases statewide. Of those, 19 of those cases are on the Kenai Peninsula. So the last two cases came up, were reported Friday the 17th. So this last Friday, we did not have any new additions over the weekend or Monday or Tuesday. One question that's been asked quite a bit is a little bit of our community breakdown and where these cases are attributed to. And remember that sometimes the cases are attributed to somebody who may be a resident of that area, but may not have necessarily been there. And that's part of the reporting standards that the CDC uses. So it can sometimes be a bit confusing, but it's definitely something that we try and explain and have folks keep in mind. So of those cases, 19, there's 1 for Anchor Point, 2 in Homer, 4 in Kenai, 3 in Seward, 6 in Soldotna, and 3 in Sterling for the total of 19. Now, of those 19 cases, 14 of those cases have been reported as recovered by the Department of Health and Social Services. So another common question is, how are people doing? And that's 14 reported recoveries. So that's what's been happening in kind of the local area. I mentioned that we're kind of in this glide path or standby mode. And I think this is definitely a tribute to the people of the Kenai Peninsula that have really taken to heart these recommendations and the mandates from the state and what we've been talking about here on this program and throughout this time, this last 6 or 7 weeks where we've been really in the midst of COVID-19, and that is definitely appreciated, and everybody is recognized for doing that and continuing to do so. So we've right now got the curve flattened a little bit. There is definitely more work to be done, and we're certainly not out of the woods yet, but we're standing by and working the best we can and making sure we're ready. But right now we haven't seen a lot of real significant changes, so we're in a steady course right now.
Dan, it sounds like there's been some changes, or is going to be some changes with the Department of Health and Social Services amending mandates. Tonight, the governor rolled out what he believes is going to be some initial changes to mandate 10, and then of course 11 and 12 will stay in place for a little while. Can you expound a little bit on that?
We can talk just a little bit about it with the information we have. The governor just here about 5 o'clock kind of made some previews, some announcements of some of those changes, but we know that there is more information forthcoming, and the governor's office has said they'll be putting out some additional information for us to talk about. So we may be able to talk about that in our next program on Thursday, but essentially some of those health mandates, so Health Mandate 10 is on international interstate travel. And that is the mandate that talks about the requirement for that 14-day isolation when anybody is traveling into the state. That has been extended until May 19th, and they are going to be evaluating that on a weekly basis. So the governor's office will continue to evaluate that, but that's still, if you, family, neighbors are coming to visit, from out of state, that 14-day isolation period does remain in effect. Mandate 11, which is on the physical distancing requirements and crowds, as well as Mandate 12 is on the intrastate travel, that prohibition of going between communities and traveling within the state. Those remain in effect, but they've been extended until further notice. So until the governor's office gives us any updates or gives us additional information, those mandates are set to continue. So it's important for everybody to be thinking about those things and understand that they are still in effect. But the governor at the same time is talking about some potential changes to, the ability for people to do business and some potential modifications. And so, again, those things have just been announced, but some business and some sectors may potentially be able to open up a little bit more with some of those precautions. And so I think the take-home message for all of our communities here and all of our residents is to just remember these things are still in effect. There may be some modifications, what you might perceive as loosening of things. I think that is a good thing to try and do and keep people up and running and businesses going. But it doesn't underestimate that this condition is still spread very easily, and that physical distancing and social isolation, not social isolation, but that physical isolation is still so critical to everybody. And remember, you're doing that not only for yourself and your family and your neighbors, but also the whole community, given how easily COVID-19 spreads. So keep those things in mind. And as the governor's office brings us more information and more details, we'll go ahead and share that with you. And of course, you can always look that up at kpboem.com. As that becomes available, we'll link to those official sources.
Thank you. And that's something I think to bear in mind is while we'll know that this is going to be official on this coming Friday, the 24th, that as they continue to give us more information through the course of the next couple days, it will allow people to prepare accordingly. But also, as you've just reminded us, the importance of still practicing prevention is very much in place and still, I wouldn't say required, but asked of all of us to please continue to do so. The washing of our hands and that 6 foot apart distance and making sure that we are adhering to those CDC requirements. How, I'm just going to switch a little bit of gears here, Anya, and ask you, with this phased rollout, how is this going to affect the borough operations, ability to do business here on the borough or in the borough?
So as a borough, we've been looking at what that, that reentry or that recovery piece of things looks like for our business. So right now, people may recall, if you've tried to do business with a borough, of course, the physical facilities have been closed to help keep our employees and keep each other safe. And that has been mirrored by all of our cities in the borough as well. So right now, we are still keeping all of our functions open. So when we talk about our really immediate functions, a lot of people think of us for that public safety, that fire, emergency medical services departments, the 911 call taking, all of those essential public safety functions are of course still happening, and they will always continue to happen. But all of our general government functions are also happening as well, but we've been doing things to move them online and provide more options for people to interact with borough staff by phone, by email, through platforms like Zoom and other video conferencing things. So that is still occurring, and our staff is still working to provide services in that manner. As these phased approaches come into play, it's very likely we'll look at our own phased approaches to being able to get things back open for business, perhaps with some limitations or some modifications that we're honestly still figuring out exactly where that's going to be, to make sure that we're keeping everybody safe and that we're able to be sustainable on that. So please keep in touch with us and continue to do business by phone or by email or online. But we may, if as soon as that safety allows, we're going to get back to allowing some of that face-to-face business as well. There have been some things that have been delayed, some types of business. So for instance, if you live in an area with a service area, perhaps you attend their board meetings or are interested in your local fire department or the road service area, those meetings are going to be restarting. So we did have those temporarily delayed due to COVID. but we are working out kind of the final details of using some of these platforms to be able to participate. So people will be able to participate online or by calling in to a toll-free number and being able to give testimony and do all those things that you're used to being able to do face-to-face. We're moving that into an online platform or a by phone platform. So keep an eye out for in the normal places in our website that you'll see those types of announcements. But all of those meetings will be announced, and of course the public always has the opportunity to comment and participate in those things. As we speak right now, the Assembly is meeting for the second time on the Zoom platform, and there is an opportunity for the public to comment and participate either online or by telephone. So that's, I think it's been a great thing. I know we've heard a couple comments that people really enjoy being able to do those things. And of course, you can always still stream those meetings online or listen to it on your local public radio station. So a lot of things to keep in mind and be able to participate, but it's been a learning curve for us all, and we appreciate the public's patience with technology. So you know, a long way of saying, I should say, that you'll be seeing your service area boards and task forces and working groups back up and meeting soon.
And one thing to note with regards to these online platforms is for folks who may not want to or think that they need to buy into a service, that's not the case. They can go do this free, for example, on Zoom. Can you just share for those of us that are new to it, what can they expect or how easy is it for them to initiate or to be part of a meeting, for example, our assembly meeting?
Of course. So there's two different ways. Let me address the first one, which is going online using the Zoom platform. You can download the Zoom software onto your computer or your phone or your tablet, and then you'll be prompted for a meeting ID. So in the notices for the meeting that you see online or posted on bulletin boards, wherever you happen to find them, you'll use that meeting ID to join the meeting at the time it starts. Once you join the meeting, you can observe, you can hear everybody. There may be video for some folks. There may be just audio. That depends on internet connections and technology and some of those types of things. So that is a little bit different. For right now, you see that most of the assembly members have video, so you can see them talking and see that interaction. During the public testimony time, you can hit a button on the Zoom application. You can raise your hand, or the clerk will call on you, and you can be able to give testimony as well. So that's how it works on the Zoom platform. You do not have to be on camera. You do have to have at least a microphone on your computer or your phone to do that. If you don't have a good internet, or you don't want to use your computer or a smartphone, there's also a 1-800 number that will be published with all of those things and with those meeting notices. You'll dial that 800 number and put in that meeting ID, and then there's some shortcuts you can dial on your phone if you wish to speak. You get called on in the same way. So we tried to make it accessible for all. We know that not everybody has the same internet around the Kenai Peninsula, and sometimes a good old-fashioned phone call is certainly the way to do it. So there will always be instructions particular to your meeting right at the start, and the facilitator will help you to give testimony. And there's always a number to call if you're having problems. So you can expect that rolling out beyond just the assembly shortly.
Thank you for that. I'm not seeing questions here. If you'll bear with me just a moment, I'll look and scroll down here to see if there's any. Seeing a lot of great comments thanking us for providing this update tonight. There is a statement here about new shipment of PPE, which I will use as a prompt. Can you share with us some information regarding PPE here locally on the peninsula?
So PPE is our acronym for personal protective equipment. Because we are government, we like our acronyms. So when we say PPE, that might refer to masks or gowns or shields or anything that we use to keep our staff or our first responders safe. There is still quite a bit of issues with the supply chain when it comes to these high demand items like N95 masks or face shields or gowns, because obviously they're in quite high demand across the country. Right now, all of our fire departments, our EMS services, have reported that they do have sufficient protective equipment for now for their calls. So our first priority, of course, is always that we're going to be keeping our responders safe, so that system can go forward. And then the hospitals have also reported that they have a good supply at the moment. Might not be at the levels that we typically have on hand, but certainly there's no critical issues with that. So you can keep an eye out on social media for hospitals and some of those things if they are looking for donations. I don't believe any of them that I know of are looking for any particular donations at this point. You may recall that masks and other things were looking to be donated at a little bit earlier, but the supply chain is improving slowly, and so that's there. But of course, for medical procedures, if you're a patient or need to interact with our first responders, those folks do have the PPE they need right now. And we're always looking for how to make sure their supply is secure so we keep people safe.
And I just want to throw out a hearty thank you to those individuals who've taken the time to make the cloth face coverings, or what we also are calling masks. There is a large group across the state. I couldn't even imagine how many, and I probably should look into that to see how many, even here on our local peninsula, the groups that are sewing and making masks and distributing them, in addition to our local efforts at Love Inc. or down in Homer and Seward. I even saw some folks who are doing it here in Sterling and dropping them off at strategic locations for their communities. So just want to give them just a hearty thank you for your efforts and kindness, your time and talents, if you will. Dan, in here, we have a question also that maybe just needs to be reiterated. I know you talked about it earlier on with the governor opening starting on Friday. How will that affect us, or how will that affect, I'm assuming, the borough? If there's just an opportunity to reiterate what you said earlier for folks that may have just hopped on.
Of course. So basically, the governor announced a bit of a preview of some changes to mandates, which does allow for some businesses with proper precautions and distancing still to be in effect to be able to open. And certainly this is going to lead into some good questions of, what businesses can open and what kind of changes do we have to those mandates. So I just want to reiterate for folks that the mandate 10 on interstate travel, that's the one requiring isolation if you've been coming from another state, is still in effect. And then the social distancing and intrastate travel, that travel between communities mandates, have both been extended until further notice. So there is definitely a balance that the administration is trying to get to, of allowing some business to continue while still keeping people safe. So continue to maintain that physical distancing. That must not stop at this point. We're doing a great job. We're working to flatten that curve. It's been doing well here in Alaska. Now is not the time to be complacent in that, and make sure we're still thinking about those things. I know it's something that we've all heard time and time again. I think most of us are probably getting pretty tired of hearing about it, but I really can't understate how critically important it is. At the same time, for operations here at the borough and probably in local governments around the Kenai Peninsula, we'll be reevaluating those phases and those different changes of approaches and how we can keep everybody safe and healthy while also providing services. And of course, just as a reminder, your local governments and many of the businesses as well are providing services that still are taking place, even if maybe you aren't physically interacting with them. And I'll remind folks on that note to head to our website, kpboem.com, and you can click on the information hub that's linked at the top on the right-hand side, or you can go to covid19.kpb.us. And there's a great map there that shows the status of businesses that have reported, and whether you can do things like perhaps your store, you can text or call in an order and pick it up outside, or pick up a meal for takeaway. So that's there. If you own a business or know of somebody and they haven't put their information on that map, please do that. And that'll help us all maintain that safety while we're still patronizing our local businesses, which it's just so critical during these times to support our local business as best we can. Everybody is struggling. We know that. But if you have the means to do that and can shop local or grab a meal for dinner tomorrow, that's a great thing to do.
That is a great segue into how we can look forward or lean forward and continue to practice the physical distancing, continue to practice the prevention recommendations that CDC is asking us to do. And one of the things that I would even bring up is if you have the opportunity to vote by mail, maybe you should do that this year. And can you share with us what that may look like at a local municipal level?
Of course, and as we look forward, we know we have some elections this year. We have some local municipal elections, and the borough clerk and relations with the cities throughout the borough are working on some different planning and different things as it relates to elections. So that's a great example of things that is a very traditional activity for most of us. There's a few areas of the Kenai Peninsula that vote by mail, but as this guidance evolves and depending on the timelines, we may still need to be doing physical distancing and doing some of those other things, even while exercising our democracy and casting our ballots. So something to kind of remind folks to do is as that's coming up, please make sure that your registration is up to date. And you can do that if you go to our website, kpb.us, and you click on the Assembly Clerk button there right at the top or in the menu. It'll give you a link to elections where they can tell you how to update your registration, make sure that's correct. By making sure that's correct, if we do have any changes, like a vote by mail, or even just to make sure that you get the proper ballot and your vote is counted without any undue process, that's a great thing to do. And so take a few minutes to do that. If you've moved recently, or even just want to make sure your ballot is in the right place and they've got your address on file. So please do that, and we'll obviously through our clerks here at the borough and the city clerks keep you up to date on what those elections look like and those other processes. But it's April. It might seem a little bit early to start thinking about that, but now is the time to make sure your information is correct. So whatever that process looks like will be hopefully easy and convenient for all.
I want to remind folks that the local municipal election is different than the state or the national election. So you'll want to also visit the state page, which those links are provided on the clerk's page as well, to ensure that you are prepared for those runoff, or not runoff elections, I'm sorry, the national elections as well. With that, Dan, I'm not seeing any additional questions in the comment thread. So I'd like to ask you for any closing comments you may have tonight.
I want to thank everybody for joining us this evening and being involved in your community and keeping up to date with what's happening. We hope that these sessions are useful to you. Our social media and online presence is also helpful for you. So don't forget KPB Alerts on Facebook and Twitter. kpboem.com is the place for some of that information as it gets posted, especially as we start looking for some of these changes in the governor's mandate and those mandates, those documents that may come out, will help you get the right information, the accurate information. I've said it a couple times tonight. I am going to say it one more time. Let's keep practicing physical distancing. Let's keep the curve flat, and let's make sure we don't have any sort of second wave or another cluster or anything like that here in Alaska. I think when this is all over, I think it's entirely possible that Alaskans can be looked at as the example of how we did this right, and we came together and we flattened the curve and made sure that we were the ones that took care of our neighbors and took care of our families and ourselves. So don't stop now, don't give up, and we're going to still get through this. And I think we're getting through it all right, and we're seeing some positive things, so we'll continue to see that. With that, I don't have too much else tonight. Again, thank you so much for joining us. We are going to be back here Thursday evening at 7 p.m. Live on KPB Alerts, and we will see you then. Have a very great night, everybody.